Hello everybody, my name is Maite Martín and I belong to the SINAI research group. I'm going to present our recent works related to extraction of relevant information from medical reports. The SINAI research group Intelligent System for Information Access was created in 2000 at the University of Jaén in Spain, and we are specialized in natural language processing, NLP. During these 20 years, we have studied and worked in different NLP tasks, applying them to several domains, including the biomedical area. Actually, we have been interested in medicine for a long time, and we have participated in different labs and competitions like TREP, CLEF, Seneval, and so on. But when we have tried to apply our algorithms and techniques in real scenario, we have always found the same two big problems. Firstly, the lack of annotated corpora for solving a specific use case, and secondly, the disponibility of medical professionals who can test and evaluate our system. However, 2 years ago, we have started to collaborate with a private radiology enterprise called Time Medica. HT Medica has a high commitment with innovation and research, and thanks to this collaboration, we have access to corporate and radiologists having the opportunity to apply our technology based on NLP in order to solve these real problems in medical domain. And this will be the focus of my presentation. Specifically, I'm going to briefly comment about 3 works in progress. Actually, the 2 first are already integrated into the clinic IT system, and doctors are currently evaluating the effectiveness. The 3rd one is already developed and prepared to be put into operation, and is related with COVID. Well, we are going to start with the detection of unexpected finding. When a patient comes to the clinic for a radiological examination with clinical suspicion of symptoms, it is possible that during the exam, other findings different or additional to the suspected diagnosis may be found. These are known as unexpected finding or incidental finding, and should be communicated as soon as possible for safe and effective medical care. We have developed a system to automatically detect unexpected findings in radiological reports, and for the training process, we have used a database composed of almost 6,000 reports, and different techniques has been applied to accomplish this binary classification problem. More details can be found in our paper published in Expert System with Application, but the most important thing is that the system is already in operation in the clinic, and it is being used by the doctors since September 2020. Just to give one piece of information, in the clinic from September to October 2019, without the tool, 154 unexpected findings were detected. And during the same period of time, in 2020, with the tool integrated into the clinic's IT system, the doctors detected 400 more cases. This is a data very, very relevant. Doctors continue evaluating the tools, and they are finding some cases of false positives and false negatives. And the tool, of course, is not perfect, but the results of the first evaluation are very promising. The second case to be tackled was the automatic protocol classification. Taking the textual information in the prescription for a radiological text by a primary physician, the system must determine the assignment of a protocol among several different possible protocols to be applied by analyzing the text and making a multi-class classification process. We have used a huge corpus level with different protocols, and as usual, we have trained several algorithms using machine learning. The results obtained are encouraged, taking into account that the system is performing a complex multi-class text classification task with a precision overcoming 92%. The proposed system is currently being evaluated by HT Medica as a decision support tool for assigning protocols. Again, the preliminary results are very, very interesting. The last problem is related to COVID. In May, after a working meeting with the doctors, we were talking about the problem with COVID, the situation, and they commented that by reviewing some reports from January, they realized that the corpus was already among us at that time. Of course, the term COVID didn't appear because we still didn't know of its extent, but other diseases compatible with COVID, such as bilateral pneumonia, appear not only in the tomography images, but also in the free text expressed in the report associated. We consider this information very relevant, and we realize that perhaps it will be very interesting to analyze the textual information, for example, making entity name recognition for symptoms, diseases, and so on. And we propose to develop a system based on NLP in order to analyze extract relevant information from radiological reports with suspected COVID. We work with a dataset of 300 reports recollected during April 2020 with a suspicion of COVID. Firstly, we use this corpus to extract disorder from Snowman CT, and we use them as additional features. In addition, we apply mutual information to integrate into only the most relevant disorder into the document representation. Then we train several machine learning systems with different parameters and different features and so on. I don't have enough time to describe all the experiment and the details about the research, but you can read the paper published in Computers and Biology and Medicine. Anyway, I would like to comment that the developed system achieved almost 90% of precision detecting signs compatible with COVID, but unfortunately today, most patients who need a chest CT scan are already infected with the virus. So our system at this moment is not going to make great prediction or great discoveries. However, it should be noted that our tool could also detect other unexpected findings related to COVID in patients who are explored for other reasons. Either now or when in the future, hopefully near, cases of COVID are significantly reduced. It could also be used, for example, to track the incidence and prevalence of COVID, allowing the detection of new outbreaks of the epidemic, or to make a retrospective search for COVID findings in patients who underwent a radiological study in the previous months to the pandemic. To finish, I would like to highlight some relevant points. Firstly, it is important to note that most of the research carried out on artificial intelligence in radiology has always focused on analyzing the image and not paying attention to the textual information. However, we have demonstrated that we can extract very relevant information from the textual reports that can help the decision-making process for medical teams. Secondly, we strongly believe that the potential of these artificial intelligence technologies is exponential if we have access to textual information in medical reports. And this is where the HT Medica has helped us by providing this collection of documents in order to train our system. But it's more, the doctors have dedicated a part of their valuable time to analyze and evaluate the tools, not only for adapting and improving our system, but also to verify that language technologies can help a lot to improve the daily routine, the daily work of medical specialists. I would like to finish with this idea because I am truly convinced that NLP and language technologies are one of the most relevant areas in artificial intelligence. NLP techniques are not sufficiently exploited or valued, probably because the professional who must work or exploit this technology, such as doctor, lawyer, public administration, marketing, and so on, don't know the potential of this kind of tool. So I think it's also very, very important. We must do this technology, NLP, visible. This is all, and thank you very much.